Happy Friday. I just want to say that it's been another week in COVID-19. It seems like another year. It's hard to believe that just 3 weeks ago we closed the rodeo, and at the time that seemed like a really, really controversial move to make. Now as we look back on it, thank God we did that, because it would be a disaster. We'd be suffering something like what happened with Mardi Gras in New Orleans had we not done that. So that was a very, very important move, and it was one, if you'll recall, it was very politically difficult to do. Since that time, about a week after that, the mayor and the county judge implemented stronger stay-at-home and work-safe rules. We also did that fairly early on, and as a result, we think it's actually working. We used to have 3,500 people here on main campus. We're down to 800, and we're still getting work done. We're still functioning as an organization. We're still doing research. We're still educating and taking care of patients, but we're doing it in a different way. We've really stepped up telehealth. People are learning Zoom for the first time. I'm doing it every night myself. So it is working, and it is important. If you look at what happens, what's going on in New York City, we don't want to repeat that. And as you know, I came from New York, and I'm happy not to be there. It's great to be in Texas, but we don't want to look like New York City in a couple of weeks. And the only way that's going to happen is if we can keep our infection rate really low. If we can keep it at the 2 to 3% rate, then we think that there's a good chance, based on all the models and all the data, that this will peak in about 4 weeks, and that we will be able to manage all the sick patients within our own hospital capacity. If we don't, and it goes up to 13, 14, 15% like New York City, then not only will we exceed our hospital capacity, but this will go on for a whole nother month. And so rather than getting over it in 4 weeks, we might be doing this for 2 or 3 months. So while it's really, really hard to stay home, and it's very isolating, very difficult, we need to do it. That doesn't mean you have to be socially isolated. You can interact with people. Zoom is a great way to interact. You can go on walks as long as you stay apart, and you can accomplish a lot of work from home, and we want you to continue to do that. As an organization, we need to continue to work hard, but we need to do it in a different way for the next several months. Now, I have a daughter-in-law who is a middle school teacher in North Carolina. And she had to go from a large classroom setting to overnight doing teleeducation. And it was very upsetting for her students who are now locked at home and feeling very isolated. So she created a little video about how to manage being home. And I thought it would be fun to share with you. So I'm going to share it with you. Besides, it's a dog video, and who does not love a dog video? So everybody keep it up. We're on the right road. We're going to do fantastic. We're going to get through this. I promise you we're going to get through it. But it's not easy, and we've got to keep sticking to our guns and being sure that we maintain social distancing and working from home and working safely when at work. So Baylor, keep it up. Keep going. We've got a few more weeks to go, but let's make sure that we are leading and not following the efforts. Thank you again to the entire Baylor community. We couldn't do it without you. Thank you.